In all places of the United States and its jurisdictions, I would have expected to find an optometrist able to evaluate my eye, diagnose the problem, and begin treatment without delay. But here in Puerto Rico, that did not happen. I came here expecting a normal trip, a few days of rest, good weather, good food, a chance to enjoy the island. Instead, I ended up with a painful red eye after a contact lens problem, scared, sensitive to light, and searching for urgent help. At first, I thought this would be simple. In all places of the United States and its jurisdictions, an optometrist is part of the front line of eye care. They are trained to examine the eye, use the proper instruments, recognize infections and corneal disease, and begin treatment quickly. That is the standard. That is normal access. That is what patients expect. But that is not what I found in Puerto Rico. What shocked me was realizing that here, an optometrist can have the training, can have the equipment, can recognize the problem, can know exactly what treatment is needed, and still be blocked by law from prescribing the medicine a patient urgently needs. Think about how irrational that is. The patient is there. The pain is real. The professional is there. The diagnosis is clear. And yet the treatment is delayed by an outdated legal barrier. Not because of science, not because of public safety, not because the condition is too complex, but because Puerto Rico is still holding on to a system that forces patients to wait, suffer, and search for alternatives, even when qualified eye professionals are right in front of them. So what happens then? A general medical office may not have the specialized ophthalmic instruments needed to properly evaluate an eye condition like this. A private ophthalmologist may not be available for an emergency walk-in. And when the pain keeps getting worse, when the redness increases, when fear turns into desperation, the patient is pushed into the emergency room. That is how I ended up here. Not because the problem was impossible to recognize, not because there were no trained eye professionals, not because timely care was impossible, but because the system made timely care harder than it needed to be. And that is the real issue. This is not just about professional politics. This is not just about turf. This is not just about old arguments and old restrictions. This is about access to care. This is about whether a resident, a veteran, or a tourist like me can receive timely treatment when an eye emergency begins. This is about whether Puerto Rico will keep forcing patients through delay, confusion, overcrowded emergency rooms, and unnecessary suffering for conditions that, in all places of the United States and its jurisdictions, are addressed much more directly. No one should have to go through this. No one should have to wonder why a preventable delay was allowed to happen. No one should have to lose time, comfort, and peace of mind because the law has failed to keep up with modern eye care. And yet, here I am, in pain, in disbelief, and asking a question that Puerto Rico can no longer avoid. Why is timely therapeutic eye care recognized as normal patient access in all places of the United States and its jurisdictions, but still obstructed here? Because from where I am sitting, in an emergency room, with a painful eye and no quick answer, this does not feel like a modern health system. It feels like a patient paying the price for an outdated law.